From the PEP Radio Newsroom, this is Lunch Hour News Blast. LGBTQ Nation is reporting that Health and Human Services Secretary Robert F. Kennedy Jr. has identified his first target following his declaration earlier this month to cut off Medicaid and Medicare funding to any hospital that provides health care to trans youth. Last Friday, in a social media post, HHS announced that it was referring to Seattle Children's Hospital for investigation for providing gender-affirming care to trans youth. The post said that the investigation was warranted for failure to meet professional recognized standards of healthcare, as according to Secretary Kennedy's declaration that sex-rejecting procedures for children and adolescents are neither safe nor effective as a treatment modality for gender dysphoria, gender incongruence, or other related disorders in minors. Of course, Kennedy's declaration was simply that, a declaration with no basis in science. Medical societies have rejected Kennedy's anti-science stance, which has led Kennedy to cut off money for them as well. Kennedy's declaration, made on December 18th, is a nuclear option to pressure hospitals to drop care for trans youth. Hospitals rely upon federal payments for treatment of Medicare and Medicaid patients. Without that money, hospitals, which are already struggling with difficult finances, will lose millions of dollars. Federal funding through Medicare and Medicaid accounts for nearly 45% of all spending on hospital care, according to KFF, the nonprofit health policy research group. Seattle Children's, one of the top 10 pediatric hospitals in the United States, has long been a target of the far right for its care of trans youth. 2 years ago, Texas Attorney General Ken Paxton issued a subpoena demanding records pertaining to any Texas patients who receive gender-affirming care at the hospital. He eventually dropped the subpoena. However, Trump's Department of Justice tried to use the same tactic earlier this year, seeking personal information about patients from providers treating trans youth. That subpoena was eventually quashed. Just last week, a federal judge in Pennsylvania rejected another DOJ attempt to get the personal health information of trans youth. Seattle Children's did not immediately respond to the threat from HHS. Releasing the information on the day after Christmas looked like an attempt to bury the news. However, conservative outlets such as the National Review and the Washington Examiner were quick to pick up the story, characterizing trans healthcare as genital mutilation. Kennedy's declaration is already facing legal challenges from 19 states. However, there is no denying the chilling effect that the ongoing threats from the Trump administration has had on access to healthcare for trans youth. More than 20 hospitals across the United States have ended or restricted care for trans youth in the face of pressure from the Trump administration. That's what we know at this hour. PEP Radio is available on the Live 365 app, the PEP Radio page at paequality.com, Roku, and Alexa. If you are watching our news content on YouTube, please be sure to subscribe to our story and our channel. Feel free to share these stories on social media. Up next, we have the snowy Meadville area weather forecast here on PEP Radio.